Okay, so our next presenters this afternoon are Jason Paltzer, Director of WELS Kingdom Workers Lutheran Health Alliance, and Michael Toppe, who also serves on the Lutheran Health Alliance Advisory Committee, with us today to give an update on the Lutheran Health Alliance and tell us about a new diabetes peer support training program launched in July of this year. So, Jason.
Thanks. It's great to be here again and just give you an update on what we're doing in the Lutheran Health Alliance of Kingdom Workers. For those of you that don't know me, my name is Jason Paltzer. I'm the director of the Lutheran Health Alliance of Kingdom Workers. My background is in public health and specifically social and behavioral health sciences. I spent a number of years in Zambia working with the Central Africa Medical Mission. I was a Kingdom Workers volunteer over there, and then moved back to the U.S. in about 2009. I've known Michael since my childhood days. His dad baptized and confirmed me, and kind of paralleled each other through our various careers the past 10 years or so. But this was the kind of the first time we've had the opportunity to really work together on this particular project that he'll tell you about in just a few minutes. But before that, I want to take about 5 minutes and just give you an overview of where we are at today with Lutheran Health Alliance, because you probably heard Dr. Carey kind of introduce Lutheran Health Alliance last year at, I believe, the same fall conference. Right. And I was with you in spring for a little bit and talked to some of you. And now, where are we at today? About almost 2 years down the road. We're just starting to get a few things off the ground, and I'll highlight a few of those for you. So as a reminder, we go this way. So what's our mission? Very broadly speaking, our mission is to be a Christ-centered development ministry that provides targeted support for families, congregations, and communities to improve their health and well-being, connecting people, ideas, and resources so that the gospel is shared. Again, there's really intent behind this word alliance, that we work with and partner with communities, congregation members, organizations that are working together to walk with families in improving their health, specifically in low-resource communities, whether it's in the U.S. or throughout the world. Ephesians 4, verse 12, to equip others to do works of service so that the body of Christ may be built up. That really drives us in what we do in terms of helping people be God's instruments. And you don't have to be rich to be God's instruments. And Bryant Myers wrote a book called Walking with the Poor a number of years ago, and it really transformed the way that we, as health-focused ministries, serve poor populations. In terms of a transformational approach, how can we help them not just with handouts, but really helping them transform their lives, transform their communities in which they're living. Long-term approach to development, relationship building. And he wrote this in terms of how do we view poverty from a Christian perspective. And he wrote, our point of departure for a Christian understanding of poverty is to remember that the poor are people with names, people to whom God has given gifts, and people with whom and among whom God has been working before we even know they are there. And such a great reminder to know that they're known by God, and it is our prayer that we get to know them as well. We know their story. We know where they come from. They're not just another poor person or another poor community that we can give something to. They have names, and they're loved. And we hope we can also be that instrument in loving them, but then also that we can equip them and walk with them, that they can be God's instruments in their own community, even though they may not have the financial resources that we have here. They all have gifts. It's our responsibility to find out what those gifts are, build them up, and let them be God's instruments in their community. It's great that Mark was able to come and give you an idea of how we as a church body and a fellowship are kind of working at each different stage of this model of development. Whether a crisis comes, a community enters this stage of relief and really needing to just survive, They get to a stage of being rehabilitated and trying to get back up to that baseline. And then there's a development phase. How can they improve and go beyond where they were? And that's really where we come in as Lutheran Health Alliance, is in this stage of development and community health improvement. Try and extend our effort to serve communities and families and congregations in such areas. Whoa, how did that just happen?
Touch the screen.
Did I? There?
Yeah.
Yeah.
Really?
Yeah.
That works.
You didn't tell me this.
I didn't know it.
Jason, don't be afraid.
So Malawi, Stefan Felgenhauer is our field manager there. We have a ministry that's serving people with disabilities, adults and children. I'm going there next week to do a training. We use different folks that have skills, so we partnered with the University of Minnesota and the Center for Community Integration. There's a woman there, a professor there, that started a program in Zambia in terms of community-based rehabilitation. How do you train, in our case, congregation members, to go and serve families that have a person with a disability in their home to help them with rehabilitation exercises, learning exercises? We're going there to do a training for the 4 congregation-based disability teams we have in Malawi, Lutheran.
It only works if you don't want it to.
It was when he touched it. Really.
All right.
It did work
You're
before.
not as cool as I thought now. Would have been. Indonesia. We brought on a health and education coordinator. Her name is Coral Katie. She spent 10 years in Indonesia teaching at a Christian school outside of Jakarta. She spent 4 years in Vietnam teaching for a Lutheran school. She decided to come and work for Kingdom Workers. And she just finished her first trip there. She's going to be doing 4 trips a year based out of Wisconsin, doing 4 one-month trips a year. She just returned. We had a chance to talk, and we're going to be working with about 4 different early child development programs that are already existing, but just need some technical guidance from her expertise. Help working with the folks at MLC, Early Child Center, try and get a different perspective of curriculum development for the Indonesian Lutheran lay leaders that have started these 4 early child programs in Indonesia, and particularly this island of Nusa Tenggara Timur, which is one of the poorest areas of Indonesia. Really high rates of malnutrition, really poor access to education. So we're going to be helping the Indonesian Lutheran Church develop an early child development program and integrating, of course, into that community health, because how can a child learn properly if they're not getting the proper nutrition or having a healthy environment at home? So we're going to be integrating those 2 aspects into the work that Miss Katie is going to do there. She goes on another trip in December to continue building on what we've learned from the first trip. Grenada, we are working with Grace Lutheran in Grenada to serve kids with special needs and learning disabilities. There is a teacher at Grace who has a master's in special education, special needs education. We're going to be hiring her on part-time to initiate a play group at the school for families with kids with learning disabilities, that they can come in. They don't have to be members. We'll probably promote throughout the community. We'll pilot it with about 4 or 5 families, see how they can, see how it goes, and then really ramp it up probably mid-next year once we learn from those initial families that have come to the program. How does the play group therapy work? What other needs are we identifying? Because the assessment and diagnosis in a country like Grenada is just really poor. You ask, what really is the prevalence of autism or other learning needs in Grenada? I have no idea. There's such a stigma around having a child with a disability that they're just kept in, that they're not even brought out of the house. So that's kind of exciting. We're moving forward with formally getting her on board with Kingdom Workers. So she still continues her role as teacher at Grace, and then as an additional 10 hours a week working for Kingdom Workers to get this project off the ground. And then the next project, which we are really starting to launch, is the Diabetes Peer Support Program. And that's what Michael will talk to you about from here on out.
Thank you, Jason.
Great, thank you. So I thought I'd just give a little background about myself as well. I'm a physician assistant by training. I've spent the past 10 years working primarily in family practice. And in addition to that, well, I just returned from living outside the state. Now I'm faculty at Concordia University at Mequon, teaching the next generation of physician assistants. But in addition to that, sort of like Jason, I have a relationship with the continent of Africa. I went there the first time 15 years ago as a Peace Corps volunteer, and actually came back just this past April from 4 years working there in South Africa. But as Jason said, we've known each other a long time, and only recently have had an opportunity to start to work together. And this is one of the main things that we've started to work on, diabetes peer support, this concept. And, you know, Jason, fill in here as well, but a lot of it seemed to be that as Jason traveled around the U.S., other countries, as congregations have communicated with the Lutheran Health Alliance, diabetes kept coming up as something that congregations are encountering, finding a problem, and that's challenging their members. And really that's not surprising. But, okay, there we go. All right. If you look at just the sheer statistics of diabetes, this is 2011 data. It's probably just gotten worse in between. 25.8 million children and adults, or about 8% of the US population, have diabetes. Of those, 18.8 million are actually formally diagnosed, another 7 million undiagnosed yet, but still having that. And about 79 million pre-diabetics. So you put those numbers together, that's really big numbers. We're talking over 100 million people in the US that are either diabetic or pre-diabetic, roughly a third of the population of the US. So it's not surprising that we're encountering it within our congregations, within our communities, because it's just a huge number. 300 billion in diabetes-related costs each year. The latest statistics I'm familiar with is the US healthcare industry about $1.2, $1.4 trillion. So this is a quarter of that budget of all the expenditure on healthcare costs in the United States is diabetes related. And this bottom one here, the average healthcare cost of diabetes is 2.3 times higher than it is for non-diabetics. And that cost is borne by everybody. Our premiums go up as more diabetics are diagnosed and cost more to take care of and have longer lifetime healthcare expenditures. And then they themselves have to bear more of the cost of their care as well. Not everything is covered. A little closer to home, some statistics for the state of Wisconsin. You can see how it's broken down by age groups there. And if we're looking at the 65 plus, basically about a quarter of individuals are going to have diabetes in the state of Wisconsin. So it's kind of striking if you just think of that. I did a presentation at a congregation not too long ago, and I went to church there that morning, and you just sit in the pews and you kind of scan and you think how many people there are sitting and struggling with diabetes that you probably don't even really know about. We had a request to do an assessment within Texas. This one's just kind of interesting because it didn't have an equivalent for Wisconsin, but it breaks it down by ethnic group as well. And you can see some pretty striking disparities. Let's look at that 65 category or the 45 to 64. Basically, if you're going to white to black categories there, you're essentially doubling it from 10 to 21% or from 19 to 38%. I mean, 38%, that's just really big numbers. And we've also had requests to look into this epidemic within China and other places. And once we started doing some digging and investigating, I mean, this is a really nice resource here, New England Journal of Medicine 2010. 92 million estimated diabetics. 92 million and 148 million pre-diabetics. So again, we're talking huge numbers. We're talking almost the population of the United States. as either diabetic or pre-diabetic within China out of their population of 1.2 billion. As I said, I've recently been in Africa. I was working in South Africa. South Africa, the rates of diabetes are rising rapidly. Pick a country. Saudi Arabia, the Middle East, throughout Europe, throughout the whole subcontinent of Africa, the rates are increasing rapidly. So part of what I had to do for my job was travel around different countries, meet and get to know healthcare providers in those areas. And one of the questions I would always ask is, what do you see? And you think you're going to see malaria, you think you're going to hear about diarrhea, and those are there, but they kept saying sugar and pressure. So diabetes and hypertension. You had a question?
Yes, I was just wondering, is it because, like, countries like China, if they're getting a more Western diet of with the fact that they're getting McDonald's and Kentucky Fried Chicken,
Yeah,
and then
you
they're
know,
getting our bad food
it's a great
into
question.
into their society.
South Africa has
Is that
more
in
Kentucky
Africa
Fried
too?
Chickens than any place in the U.S. that I've seen. It's
Oh,
incredible.
yeah?
They're
Okay.
everywhere. But that is some of it, is that they're going to, but they're going much more abruptly than we did. We took generations to try to, sort of transition from farm and rural-based to urban-based and, desk-type jobs where you didn't have the same physical activity, in parallel with the rise of, much higher calorie consumption per day. And they're getting there really quick. They're doing it in a generation.
They've discovered it, and
They've discovered it, yeah. And so they're going through the same transition, but just much more rapidly. And there seems to be something as well that if you go through it quicker, that transition, it seems to impact in things a little more pronounced than if you go through it more gradually.
Yeah,
And then
we hear
certain
about
populations have a certain genetic predisposition for that, like Indian, the subcontinent of India. Even before sort of more modern lifestyles, they've always had a very high rate of diabetes
Okay.
within that. So it's really striking. I mean, it's a global phenomenon. So in response to that, Jason contacted me early this year, I suppose it would be, and we first started talking about what kind of response can WELS, and in particular the Lutheran Health Alliance, try to formulate for something like this. And as we did research, as we looked around for different models, concepts to address this, one thing we came across is the concept of diabetes peer support. And peer support is based on the concept, make sure I get this number right, 8,760 hours, correct? That's how many hours there are in a year. And the typical diabetic is going to spend 6 hours per year with their medical providers, with their nutritionists, with their podiatrists, with their ophthalmologists, with all of the many different specialists and healthcare professionals that need to be involved in their care, leaving them 8,756. 54, he's the statistician. 4 hours essentially to manage their disease on their own. And it's really nice talking to nurses who have all worked obviously with patients. And if I look back, as I said, 10 years in family practice medicine, sometimes you have somebody exactly on the right plan. You've done all the steps, you've sent them to the nutritionist, they're up to date on their ophthalmology exam, their podiatry exam, you've been checking their BUN and creatinine, and you've got them on the right regimen of medication, and then they come in and you check their hemoglobin A1C, and it's just not making sense. And I would see that again and again, and it's all these other things that happen between the 3-month checkup, between the 6-month checkup. It's the access to the insurance. It's the sheer fatigue of taking all those medications, of checking their sugar, of hoping, maybe if I stop it, this time it'll be different somehow. Because living with that disease for a long time, for years and years, can really be a burden. And we didn't create this from scratch. There's models out there for peer support, and the concept that somebody works with you in those 8,754 hours. Checking in, encouraging, supporting. The Veterans Administration uses a model like this. A number of
Called
universities, sorry,
It's called Prevent.
you're familiar
Yeah, I'm
with it?
familiar with it.
Okay, great.
I work with it.
A number of other organizations have done some similar things. And there's different models. Sometimes it is an actual diabetic supporting existing diabetics, sometimes a very successful diabetic that can model good behaviors. But it doesn't have to be. Sometimes it can be somebody just within the community that is showing an interest and wants to be involved with it. Because sometimes it's just that little push, that little encouragement to get through a particular challenging phase or time that can make all the difference between them adhering to their medicine and the lifestyle modification or not. So we took an existing curriculum, we modified it, and now we're starting to roll it out. And it fits within Kingdom Worker and Lutheran Health Alliance model because it's not just a healthcare issue, but it's also a real opportunity for outreach into a community and in-reach within congregations. Again, we look at the statistics of how many people have diabetes within our congregations, it's a lot. And this can be a real opportunity to work within our congregation, within our fellowship to help individuals struggling with this, but also an opportunity to go outside the congregation and witness. So the process, we've sort of developed 6 steps for this, and I'll address most of these, and Jason's going to weigh in on step 4. Step number 1, information and commitment. So obviously, before people would want to participate in this, they need to be aware that this opportunity exists. And so we're working with promoting this idea, promoting this model. And then individuals within congregations will need to discuss this with the pastor and with the outreach committee. And we've worked with 2 groups, and it's followed that model. In one, both were very supportive, and we're moving forward with this process. In another, it didn't quite work at that time. They weren't quite ready for this model at this time. We asked that people who would want to participate in this interview somebody who has diabetes. It could be a family member, it could be a friend, it could be somebody that they're linked to somehow, and just try to get a sense of the personal challenges, the knowledge of local resources in that community, and some of the stories and context in which they live with diabetes. And then that group or individual can request additional information from Lutheran Health Alliance, and we'll supply that. That goes to what we'll call step 2, or pre-training. Review the summary document about what is involved in this sort of training. Explore a bit further within the community, within the context, within the church, different opportunities. Identify interest from other members, advertise the program within a congregation, and schedule the first phase training. The first phase training, I've done this twice. One with a group from the chapel in Madison, and another with a different congregation within Madison, Our Redeemer. And so each of those, the one group had 4 individuals who were interested, and the second group had 3 individuals who were interested. I went there, and it was about 5 hours or so, and we talked about the various topics that are here. We had a basic discussion on the basics of diabetes, self-management with diabetes, and then implementing diabetes peer support, and how you might actually implement and roll out something like this within your congregation or community. Step 4, then, the training is built to be sort of in 2 phases. The first one is to introduce members to this concept and get them doing some very basic activities within their congregation or community. The next part of the training can happen months later, where we go into a little more depth, a little more one-on-one relationship with individuals. Jason just came back from Madison yesterday and met with the individuals we've taken through the group. So I'm just going to ask him to speak a bit on some of the things these groups are looking at doing.
Yeah, so 2 very different groups, and it's interesting because really working within your context can change your approach to how you serve your community and those within your community with diabetes. So the first context is within a graduate student housing area at the University of Wisconsin. And it's a group of 4 international women, spouses of some of the faculty at university that are from China, Korea, Japan. I believe one person's from Thailand. Or Nepal.
Korea.
And these 4 women that were connected to us through the Wisconsin Lutheran Chapel. So for those of you that may know, Carrie Larson, who's the international outreach coordinator, contacted us and said, yeah, they do talk about it, so maybe some of them would be interested. Sure enough, 4 women were interested in receiving training, took them through the training. And one of the things that they're thinking about doing is, number 1, just doing an information session on diabetes in Chinese. You'd be surprised how many family members from China come to visit their family in Madison. And there's this, and they don't just come for a week or 2. They're coming for 6 months, a year. That's a visit. So they're actually living there. And so it's a great opportunity to not only hit the families of Eagle Heights, but then the family members that are going back and living in China and equipping them with information on diabetes care, self-management. So they're going to have a information session in Chinese and in their native languages to really help encourage awareness around the Eagle Heights area. The second thing they want to do is just have a walking group around Eagle Heights. It's a real beautiful area right on Lake Mendota. And especially now coming fall, people are getting outside less. And so you're going to need a little bit more encouragement to go outside and just do some activity. So they're going to try and do a walking group with individuals that know they have diabetes and they know that you should be getting outside or getting some sort of activity. But then they also said, we'd like to get in touch with that other group at Our Redeemer. And so this other group at Our Redeemer has kind of talked about doing some similar things. It's a group of 3. One gentleman has diabetes and sells health insurance. Another gentleman had a wife who died of complications with diabetes. And another woman has just a family history of diabetes. So different backgrounds, but they're all interested in this one area of service and outreach and support. They're coming together. They weren't sure what to do. They're thinking of a health fair. So they're going to schedule a health fair in March. But then they said, we don't just want to have a health fair for information. We want something action-oriented. So they're going to organize. They're about 2 blocks from a big park in Madison called Elver Park, if you're familiar with Elver Park. And they said, let's organize a 1-mile walk, diabetes walk, around Elver Park and have it end at Our Redeemer Church and then have them go into the health fair. And they'll have one of the members, his name is Mike. Mike said, I have a podiatrist. He wants to come and help out at the health fair. So we're going to get a podiatrist, a dentist, maybe work with some other groups to do screening at the health fair. It'll be a health fair, but it'll be diabetes focused and really try to increase awareness and information and establish an action-oriented program within Our Redeemer so people know that this is going on. And the idea is that some people will become part of a regular walking group around Elver Park. Again, congregation members and or hopefully members of the local community, which is a blessing in the sense that it's a very diverse community around Our Redeemer. A number of African American families live in that area, so it's a real neat opportunity. And then if they bring the group from Eagle Heights, now you have these Chinese families and Japanese families participating in a walk. It's just kind of a really interesting opportunity. So that's kind of, it's nothing real intrusive in terms of going and knocking on doors and saying, hi, we have a diabetes liaison program, would you like to be part of? But just something that is basic, information driven, but yet there's a next step action oriented on the other end of it, that you can build on those relationships that you're making through those activities. So.
Yeah, and it's been really, really amazing, really a blessing working with these 2 incredibly different groups and hearing their stories, hearing how they're impacted by diabetes, and hearing their ideas and strategies to try to address it in some fashion in their community. And again, kind of how we talked about, I showed a slide on Wisconsin, Texas, China. It's all kinds of different communities. Phoenix area has contacted requesting, there's several congregations interested in pursuing a training there. When we were in Las Vegas recently, meeting with a group out there, very different population, there too, there's an impact of diabetes within that community. different opportunities, but that's a nice thing about this. You're working with people that already know their community, already know their congregation, and can have some really creative ways to work within it. So that is basically kind of that first step. It's creating a group, sort of a special interest group within a congregation that has a desire to work in this area, that has a desire to share the word through working in this capacity, and then to give them tools and encouragement and help them to work to roll out some of these ideas and some of these programs.
And move forward.
Oops. The plan then is to provide a second phase of training, possibly months after this initial phase, after there's been time to do a health fair, after there's been time to get to know some individuals within the congregation. And then this becomes a little more personal level. This becomes a little more sitting down, sometimes on a one-to-one basis. And especially within the one context in the Madison group, where you have individuals who have been impacted very personally. Either they themselves have diabetes, or they've lost somebody due to diabetes, and sort of becoming a peer mentor to somebody that is living with and perhaps struggling with diabetes. And there's sort of tools that they can utilize, and they try to identify where is the need, where is the area where somebody's struggling with. Are they having trouble accessing healthcare? Perhaps they have transportation difficulties. Are they having difficulty affording some of the medications? You might be on multiple medications with this. Perhaps your Lancets aren't covered. All kinds of different things like that. Are they just needing some assistance with the nutrition aspect, with the exercise aspect? And there can be this training where they become adept in working individually to help identify individual hurdles with people to help them overcome that. And then in a similar fashion, after the training, rolling out that part of things. Now the one group has gone through the second part of the training as well, the more the peer support, the one-on-one level, and we're waiting to see how that will actually work and come about. That's the international group. And that's a unique niche there. They're more comfortable, for instance, speaking in Chinese. So they're looking at opportunities for where they might reach out to that kind of demographic. And that leads to this last bit here. Let me turn this over to Jason again.
So just wrapping it up, we are holding a free Phase 1 training here in Milwaukee for any congregations in the area that are interested in getting something going. It's going to be November 22nd from 9 to 5, and it'll be at the Kingdom Workers Office Building in 2323 North Mayfair Road.
And you do not need to be a nurse.
No, oh, that's a great point. You do not need to be a health professional. Like I said, the one group from Madison, there's just some family history there that is making somebody interested in being part of this program. And that's the whole idea, is that this is not a program to provide clinical services or clinical advice. It's a program to really provide the emotional and social support that's needed to actually kind of adhere to and get through the emotional challenges of having diabetes, and how that can have a huge effect on your overall lifestyle and behaviors, especially on a new diagnosis like that.
It's meant to be complementary to the medical infrastructure that they're already seeing, the nurses, the doctors, but to complement that. And there's been studies of these things, and it shows that individuals can have better qualities of life when they're engaged in a program like this.
Yeah. So that's a great thing, Sue. So that's the website, or the registration form, very simple, is there to fill out. I'll get an email and I'll put together a list. It's limited to 30 people. So if you're interested, please register. It'd be great to see you there on November 22nd. And then lastly, for those of you that didn't get the message about the Christian leadership experience that Kingdom Workers is part of in terms of putting on down in Scottsdale, Arizona, it's a great opportunity to connect with other Christian leadership organizations within our fellowship, Time of Grace, Grace in Action, Lutheran Home Association, Kingdom Workers, Antioch Foundation, I think I'm missing some, but they're all co-sponsoring this event down in Scottsdale. There's $200 round-trip flights out of Milwaukee through Southwest. There's about 60 spots in that package, so if you're interested, jump on that. I think it's $100 registration, $130 to stay at a really nice resort in Scottsdale for a few days in January. So I have information on that. That's it. Thanks for giving us a few extra minutes on that.
Thank you, guys.
Jim,